Hi, good morning, everyone. Feels good to have you back again to Oraposium 37.0. You're all welcome. Hello, can anyone hear me? Good morning, Mr. Stephen Adamo. Good morning, Mr. Ahmed Olalekan. Good morning. And to our lead mentor, good morning, sir. You're welcome to today's Oraposium. Can anyone hear me?
Yes, I can hear you, ma. Good morning, ma.
Good morning, Mr. Ahmed.
Thank you, ma.
Yeah, welcome to today's presentation. Please, while we wait for the time to start and for the presenter to join in, please can you kindly share the flyer for today's presentation across different social media handles? This should enable and encourage others to join us this morning. So please, even if you've not done that this morning as a reminder, you can do that across your WhatsApp, your Facebook, Instagram before we start. Thank you. Hello, good morning, everyone. Welcome once again to Oraposium 37.0. I can see Earth, and if you've not shared our presentation slide, kindly do that this morning to encourage others to join us. Thank you very much, everyone, for joining. My name is Nguchika Charity. I'm a fellow Oracle College of Scholar. And this morning, brought to you by Oracle, is Oraposium 37. We'll be talking about oral health promotion, a necessity in preventing oral diseases by one of us, a fellow Oracle College of Scholars. So briefly before we proceed with today's presentation, I know that we are all members of the community, but because I'm seeing that there is no new member, but of course we just have to introduce the college and also the community to you all. For the benefit of those that will be seeing this video later or these recordings later, this is Oracle. And Oracle is an acronym which means Oral and Public Health. Oracle Incorporated is an international, independent oral and public health information, education, and research organization incorporated in the Republic of Gambia. We exist to give underserved populations swift access to information, education, and research in the underserved areas of oral and public health discipline. Our mission is to support the development of oral and public health manpower, services, and consumer products in resource-limited contexts by catalyzing aggravated access to information, research, learning, and innovation in underserved disciplines of oral and public health. There are so many entities in the Oracle family which work in synergy to execute the mission of the organization. And these entities include the Oracle School, where we have short courses, short and affordable courses for professionals who want to upskill in their various field. We have it available, so you can just check up the website www.oracle.org to get more information, or you can send me a message to guide you through any of our courses. Then we have Oracle journals, where we publish oral and public health journals are published strictly in the Oracle journals. And then we have our Oracle literature review. We have the Oracle community. where you are currently, and some of us are members, and it's good to see you. So we also have Arapo College of Scholars, where the members are the ones doing the presentation. Currently, the new cohorts are the ones doing the presentation. So if you want to join the next batch, or if you have someone that may be interested in this scholarship, kindly go through our website to get more information, or you can just send us a message. Thank you. So this morning, without uh, further delay, we'll be having a very interesting session by one of us, a member of the college, who will be speaking to us on the topic, as earlier mentioned, oral health promotion, a necessity in preventing oral diseases. She's a registered dental therapist and also a content writer. She's a customer service specialist and an IT support specialist. She currently have a higher national diploma in dental therapy, a diploma in IT support and customer service, and also a diploma in IT support fundamentals. She currently runs a mobile and online dental studio with the name Perfect Smile Dental Studio. She's also an IT support specialist and a customer service agent at My Home Bedroom Accessories. So, ladies and gentlemen, let's welcome Igbonekwu Oluebube Cynthia, as she'll be speaking to us on the topic oral health promotion, a necessity in preventing oral diseases. Before she proceeds with the presentation, please be informed that for the sake of the new person that may be joining us, this paper has gone through scrutiny, and during the course of the presentation, we will not entertain any distraction and any correction to the paper. So if you have a question, kindly note it down while the presentation is on, and at the end of the presentation, you will be given an opportunity to ask your question. Okay, please note that there will be no correction to the paper presentation, but rather questions and commendation is welcome. The paper presentation is meant to last for 15 minutes, so I'll urge the presenter to stick to the time and um, deliver effectively. Thank you very much, everyone. The presenter, please can you go ahead as I share the screen?
Good morning, everybody. Please, if you can hear me, just answer. Good morning, everybody.
Good morning. Your voice is echoing. Can you please, if your, I don't know your location or maybe your.
Good morning, everybody.
Good morning.
Can you hear me now?
Yes, good morning. We can hear you. Good morning.
Hello? Can you hear me? Good morning.
Yes, I can hear you. We can hear you.
Okay. Okay, I'm happy to be here this morning, and not just for the Oraposium. I'm happy to be presenting this topic today, being the 2nd of September 2023. Standing on the already existing protocol and having been introduced, I wish to proceed. Oral health. Today we'll be talking about the topic oral health promotion, a necessity in preventing oral diseases. This, the major aspect of oral health promotion is to prevent oral diseases. So we're going to be talking about this topic. We'll be digesting it under the following headlines, which includes the oral diseases, the oral health promotion, ways to promote, ways oral health promotion helps in preventing oral diseases, strategies to promote oral health, the conclusion and references. So we begin. In 2019, oral diseases were the most common diseases globally and regionally, affecting estimated 480 million people. That's 43.7% of the people in the World Health African region. This as a result of low level of oral health awareness and promotion among the people living in that particular area. We know the world. This data was collected by the World Health Organization itself in 2019. Oral health promotion actions, like oral health promotion, it comes with different approaches. It helps to which the main approach is to improve health, and we all know that according to our sustainable development goal, one of it is health for all. It cannot be completely achieved if oral health is not included. When there is no perfect oral health, you can't say that the sustainable development goal, which is health for all, is achieved, because oral health is a key indicator of our overall health, well-being, and our quality of life. A variety of illness and ailments can result as a result of unhealthy oral cavity. Looking at all this, then we need oral health promotion in order to prevent oral diseases. What are these oral diseases we are talking about? The oral diseases we are talking about, there are issues that impact our health, our oral health, which includes our teeth, our gum, and the surrounding tissues. Most diseases are caused by poor oral hygiene, improper method of toothbrushing, flossing habits, bacterial infections, nutritional deficiencies, bone resorption diseases. And all these, somebody that is not aware of oral health cannot have a good oral hygiene. Many people don't know about the proper method of toothbrushing, and majority don't know about floss, talk more of having a healthy flossing habit. There are, like, the nutritional deficiency, many kids now, parents feed their kids with sugary food and mainly carbohydrates with little oral hygiene practice. This is one of the leading causes of dental caries in children now. And all these oral diseases are mainly indicated by pain, bad breath, and loss of function of the teeth. And it may even result to loss of function of the oral cavity in general. According to Macro, Lorna, and Roberts, these oral habits I will mention now are the most common type of oral diseases that affect the masses. We have the gingivitis. Gingivitis is an inflammation of the gum. When I mean an inflammation, I mean it's like swelling on the gum. It's often characterized by inflamed gum, that's a swollen gum, bleeding gum, pain, high level of dental plaque and calculus. Gingivitis mainly affects both adults and children because when is a first indication, is mainly one of the first indication someone gets when there is an oral disease. Is like a receptor that shows that there is something like a danger sign in the oral cavity. On the second, we have the dental caries. Dental caries is also known as tooth decay. It is the most common, is the number one leading dental disease now. Is the first and the most common leading dental disease, because out of, if on an examination of 10 people, you will observe that at least 5 to 6 has or had dental caries. When I mean has or had, either you are seeing an extracted tooth or you are seeing a filled tooth. This means that the person have had a case of dental caries before. And what is this dental caries? It is a tooth decay, an infectious condition that deteriorates the structure of the teeth. The most common result of dental caries is a cavity. That's a hole or space in the teeth. And without proper treatment, the hole in the teeth can result to pain, tooth loss, and in rare cases, the infection can spread to the brain and lead to death. It usually appears At the beginning, like I said, it appears as a small light brown spot on the enamel, and as it progresses, it deepens and may turn painful. The normal treatment for this dental caries is usually a filling, a root canal, or extraction. On the third, we are having the dental erosion. Is a loss of the tooth enamel caused by acid attack. Enamel are the normal outside layer of our teeth that helps to protect the dentin. But when the enamel is worn off, that's when you have a dental erosion. The person will start experiencing teeth pain, sensitivity. That's why when the enamel is lost, you start having sensitivity or pain. And the next, we're having gum recession. It's also called the receding gum. Gum recession is when the gums have gone below the it is not covering the teeth, the crown of the root of the teeth again. The roots are being exposed as shown in the picture below. It is when the gum is being pulled away from the teeth, thereby exposing the roots of the teeth. This leads to teeth sensitivity and a higher risk of decay. And in some cases, the teeth may fall off. This is one of the major causes of loss of teeth in old age. And people may tell me to losing teeth at old age is just because of age. It's not as a because of age. It's not necessarily as a because of age, but because the gum has receded. And the gum being the only support the teeth has, when it's gone, the teeth falls off. On the next, we're having teeth sensitivity. Is another disease that is on the range, like is getting rampant, because on a scale of most persons that come to the clinic, you notice that my teeth is paining me, I'm having chills, and normally we recommend most what they will use for the sensation, meaning, and this result to pain and discomfort in the teeth, and is affecting if sweet things, when the person eats sweet things, extreme temperature like cold or hot water, or acidic substances, and in some cases even air. Once air enters the teeth, the person feels the sensation or the shock. We have the dry mouth. This is when there is underproduction of saliva. This, as we know, the saliva helps the mouth to stay fresh. When you produce saliva, you keep your mouth fresh, just how the chewing of healthy gums help to keep the breath fresh by producing saliva. When there is dry mouth, there's underproduction of saliva, which can lead to sore throat and bad breath because the mouth is not cleansed. And we have another disease, which is the bad breath. This is also known as halitosis, orifactor oris, or our mouth odor. Mouth odor is a noticeable, unpleasant odor that is present and perceivable. It can be caused by diet, underlying health condition, poor oral hygiene, etc. There are different causes of bad breath. That's when someone has bad breath, or when someone has halitosis, the person is being advised to come to the clinic. So we'll be able to find out what actually is wrong with him or her to be able to produce diagnosis suitable for the condition. We have the temporomandibular joint disorder. This is when the opening or closing of the mouth that interferes with chewing, talking, etc. It is caused by jaw injuries, long-term teeth grinding, clenching, and other medical conditions. On the next disease, we have malocclusion or malalignment. This is a malalignment or incorrect relationship between the teeth of the upper and lower dental arc when approached each other, or as the jaw closes. One of the leading causes of malalignment now is bad oral habits. That's one of the leading causes, like thumb sucking and tongue sucking. Many little bad habits, mainly seen in children, and also in the case of the milk teeth refusing to fall off and the permanent teeth is coming out. It also causes malocclusion or malalignment if the parent doesn't take the child to the clinic. I addressed this issue, and I noticed a lot of people still, when they see the child having the permanent teeth out in a wrong position, they leave it, and at the end of the day, you see many people wearing braces. This is one of the leading causes of it. Braces is the correction for the malalignment or malocclusion. We have the mouth or oral cancer. These, as we know, cancers are abnormal growth of cells in the body. So this abnormal growth happens in the mouth, and it's commonly comes in as a mouth sore, and it doesn't disappear. Very soon they become big, and as time goes, it progresses and gets bigger. They are life threatening, and if they are not diagnosed or treated early, it's always not funny. It leads to death in most cases. So we have the mouth ulcer. They are just small painful injuries or lesions at the base of our gum that are caused by infection, allergies, trauma, tobacco, smoking, etc. We have the oral thrush. This, as just like the oral candidiasis, is a yeast infection resulting from an overgrowth of candida fungus that lives in the mouth mucous membrane. On the next disease we'll be discussing about the dental trauma. This is a trauma or injury that occurs after an accident can range from small to complicated injury on the teeth. Like dental trauma, mainly when people are not educated about dental trauma, it will not be handled well. A good example of it is parents. When parents that don't have, like, example is I had a case where the child's teeth fell off when he fell from the stairs, and the teeth came out as a whole, and she left it and came to fix denture for a 10-year-old. I was like, what happened? Where is the teeth? Why didn't you come to the clinic? Which, if parents are made aware that when a child's teeth falls off immediately, that it can be replaced just by putting it back and holding it, and rush to the clinic, with the teeth will not be lost, and the child will not have to lose his or her permanent teeth just because of ignorance. So I believe when people are aware, in this case of accident or trauma, or even during fights and the teeth falls off, there are little things that could be done that will be able to save the situation. But so we have the right, we have the job to educate our neighbors, everybody around us. This is what you do when this happens. So that's the work of the oral health promotion in this case. And we have another disease called NOMA. This is a necrotizing ulcerative stomatitis. You can as well call it canchromoris. It's a rapidly progressive but fatal infection of the mouth and face. The mouth develops ulcer and is rapidly followed by painful tissue degeneration, necrosis of the tissues of the bone in the face, and this is common with children between the ages of 2 to 6, and it's seen in least developed countries. That's when I say it's mainly found in people that are not aware about their oral health. And another disease we have is the cleft palate and cleft lip. This is one of the most common birth defects seen. Is one of the most. It occurs when the child is being formed at week 5, and the palate or the lips did not close together. It is an cleft lip or palate, as the name implies, is an opening or slit in the upper lip or roof of the mouth, or both. It can occur as a cleft lip, like only affecting the lip. Sometimes it occurs as a cleft palate, affecting just the palate. Most times it can occur together. That's a cleft lip and cleft palate occurring in one. So it is when the facial structures of that unborn baby does not close, like is a birth defect. The child comes out with it like that. So the good news about cleft palate and cleft lip is that it can be treated by surgery. There is a surgical treatment for this. And now in Nigeria, southeast Nigeria, Ebonyi State precisely, they have been advocates for free surgeries for kids having cleft palate, and it's free. Like the surgery is for free. So this is one of you. So having someone in Nigeria or even in the southeast still leaving a child with cleft palate is because the person is not aware. The person is not enlightened about the free surgery going on, or that even the cleft lip or palate can be corrected surgically. So this is where the help of our oral health promotion comes in, with our social media, with other things that our social media, our words, even in our churches, in our everyday life. The air we breathe should be about educating people and others about the opportunities and the effects of oral health in our life, in the life of our children and community in general. So we'll go to the oral health promotion proper. What is this oral health promotion? As the name implies, before I read from my slide, the oral health promotion we're talking about, when we talk about promotion, we promote our goods, we promote our services, we promote ourselves. Most times we promote our church programs. So in this case, we are promoting our oral health. Is a public action to protect or improve oral health, to promote overall well-being through behavioral, educational, and enabling socio-economic, legal, physical, environmental, and social measures just to promote our oral health. So in oral health promotion is a combination of interventions designed to facilitate the achievement of oral health and prevention of diseases. The main aim of oral health promotion is for the upliftment of the oral health of communities rather than individual, and has a long-term impact. It is a planned effort to build policies, create supportive environment, strengthen community actions, develop personal skills. Its oral health promotion involves partnership, participation, and protection. What we are talking about in general is that oral health promotion is not just for one person. You are not talking to just one person. We are bringing the whole oral health community to this community in general. And it's not just to tell them about brush your teeth, do it twice a day, do it like this. We are talking about the behavioral aspect of it, where the habits involved, the nutrition aspect, every aspect of the person's life that can lead to a promotion, to a good oral health. Because you can't talk about oral health and not talk about habits or behavioral changes. Let's use the word behavioral, because our habits and behaviors, which can affect our oral health, are so many. Let's take it to the normal bad habits we have: smoking, thumb sucking, use of tobaccos, opening our bottles with teeth. So as a health advocate, as a health advocate, it's our duty to promote oral health anywhere we see ourselves. So oral health promotion helps to bring oral health care and information to our community's doorstep. It entails making oral health care affordable through free dental checkups, treatments, building dental facilities to make oral health care accessible, providing sustainable solutions through behavioral changes by enlightening the community members on oral hygiene procedures and measures, encouraging healthy habits, and integrating oral health topics in school curriculum in order to educate the students early enough. Like they say, catch them young. In the picture we have, this is the main aim of oral health. Oral health is more than a beautiful smile. It means having healthy teeth, gum, lips, tongue, salivary gland, chewing muscles, hard and soft palate, healthy mouth and throat linings, healthy upper and lower jaw. So our main aim in oral health promotion is to have a healthy oral health, which comprises of all these I mentioned, which are listed in the picture above. So what are ways oral health promotion helps in preventing oral diseases? Ways they help to prevent oral diseases, there are so many. Like, we can't mention, even from what we are saying, we've already talked more than enough of ways oral health can help us. But let's list just three. Oral health promotion helps to bring a positive change in diet. So with oral health promotion helps educate young people on importance of a healthy diet and also educates them on the food that may be a causative factor for oral diseases. Example, sugary food. This is mainly the major cause of diet is one of the major causes of dental caries, sugary foods, and most parents still tend to give their children more than enough sugary foods with little oral hygiene practice, and this is why people is one of the major or leading cause of dental caries, which is the number one oral diseases experienced. In the second one, we have positive change in lifestyle or habit. Healthy living is one of the focus areas of oral health promotion, and it includes changing bad habits such as smoking, alcohol consumption, opening bottles with teeth, etc. It also includes having value for oral health and seeking prompt intervention when in need of oral health care. This in oral health promotion helps us to have a change in our lifestyle or habits, a change in our thinking actually, because you see someone that is dying that has toothache and the teeth is completely bad. Instead of going to the clinic, the person insists on, I'm not going to the clinic because I will remove my teeth. I'm not going to the clinic because I don't have that kind of money to spend. I will use so and so, I'll use so and so. And at the end, complicating issues. I've witnessed where some toothache killed someone because of silly lifestyle. This is actually one of the most traumatizing deaths I've experienced. But silly lifestyle, refusing to remove a wisdom tooth, that's the third molar, that has completely gone bad. She's diabetic and she refused to come to the clinic. Even when she came, she was given an advice on what to do. She left and never came back. When she came back, her blood sugar was so high that she was having that one as sickness. With the toothache, the matter was too complicated. They couldn't touch her. The clinic could not even do anything to help her because she has injury on her leg that has refused to go for a very long time as a result of the diabetes. And at the end, she died. Is a painful death because she had pains all over and complications here and there, which could have been avoided if she listened or came to the clinic when need be. She had a positive change in her lifestyle that's seeking prompt attention when there was need in the oral health care. So in the third one, we're having change in oral hygiene practices. Poor oral hygiene is the major causes of dental diseases. And with oral health promotion, it helps to educate people on the necessary steps to take in order to maintain a good oral health. Oral health promotion, most times you cannot go for an oral health outreach without teaching how to take care of your teeth. It's one of the teachings that we give in oral health during oral health promotion. We teach about the ideal method of toothbrushing. We teach about flossing. So about the time for brushing. Most times you notice on social media that most dental practitioners now scream every night, brush your teeth before going to bed. And this is a way of promoting a healthy lifestyle and a change in our in the community's oral hygiene practice. When you scream brush your teeth at night and the person has been saying it, and the person sees your social media every night saying brush your teeth at night, what do you think that will happen? Automatically, the person may try one day, let me brush my teeth and see how it goes, and sees the feeling of having a healthy brushed teeth at night. The person will not go back to it again. So we're going to the last but not the least, strategies to promote oral health. What are the strategies? Several strategies have been adopted by governments and non-governmental organizations to make oral health promotion effective and attractive. And this includes but not limited to. For oral health promotion, to promote oral health, there are strategies that should be adopted. It's not just this, but we make things to be like attractive, to make it to be interesting to people to listen to. we need to make it to be nice and attractive and effective as well, not just to talk. So there are ways that oral health promotion are being done, and this includes free or subsidized treatments for oral diseases. During most oral health promotion programs, free or subsidized treatment is given to the participants. This helps to curb or reduce oral diseases in that community. In this country, especially in Nigeria, they like free things, honestly. So I made a post on social media like, come to the clinic with and scale your teeth. The next reaction the person gives is, I don't want to wash my teeth, it's not necessary, I like it like that, it's not disturbing me, it's not paining me. But when the person hears so and so is organizing outreach, free treatment, check the number of people you see on the queue, and it's mainly those people that said it's not paining me and it's not doing this thing. But because of the help of oral health promotion, the person is able to get a free treatment. Let me just assume scaling, for example, and this has helped to reduce diseases or that would have occurred as a result of the dental calculus the person has. So we have early oral health education to children. This includes inculcating oral health education in children helps them to master the act of proper oral hygiene, thereby protecting themselves from the occurrence of oral diseases. When oral hygiene education are being inculcated in children, it helps them to, like I said earlier, it helps them to master it. Like they say, catch them young. So when they have a good idea of what they want to, of what they are supposed to do with their oral health, they know they're not supposed to open bottles with their teeth. They know they're not supposed to play roughly and have their teeth removed, or even when it occurs, they know what to do or how to report to their teachers. Or when all this, they know they have to brush twice a day, morning and night. What else do you expect from a child? As we were growing, our parents made us have our bath in the morning. So there is no way a child will wake up for the 5, 6, 7, 8 years of his or her life. He has been having his bath morning and night and brushes his teeth morning and night. He can't suddenly wake up as an adult and stop having his bath or brushing his teeth. It's already part of him because he started doing all these hygiene practices as a child. So this is the effect of early childhood education or early education of children on oral health. So, and we have another one, free fluoride application. Oral health promotion programs most often provide free fluoride application to participants, especially children. And this helps to reduce the number of children with dental cavities in that community. In a community where they don't have any access to fluoride, maybe the water it doesn't have fluoride, you notice most of them don't even use fluoride toothbrushes, fluoride toothpaste, sorry. And at the end, it results in rampant caries among the children in that locality. And when there is a free fluoride application during the health outreaches, it helps to curb or reduce the number of children with oral dental cavities in that community. These are the strategies and many more that we can use to promote oral health in our different and various communities. In conclusion, it is evident that prevention as a strategic approach to delivering healthcare value which is, like we say, prevention is better than cure, is the message of yet the message of oral health is almost untapped in Africa. Dental practitioners have the responsibility to adopt and promote preventive oral health care measures to deal with the rising prevalence of oral health diseases in the communities. So with this in conclusion, we are urging ourselves as health practitioners, dental health practitioners, be you a therapist, a surgeon, a technologist, a nurse, a technician, we health practitioners have the responsibility to use our social media, our mouth, our everyday life to promote oral health in our communities because it's still untapped and we still have a long way to go, which we can do and start curbing it by using especially our social media to promote oral health. Thank you so much for listening. These are our references below. You can check them out. So thank you so much for listening, and I'm grateful. And also, today is my wedding anniversary, and I'm happy to be delivering this topic. Thank you so much and have a lovely morning. Thank you.
Thank you very much, Oluebube, for that interesting session on oral health promotion. I believe that this topic is just it's something like to enlighten us more. You know, most of us are dental health practitioners. We know all these things, but it's also a task to motivate us, you know, to act. Maybe in our various fields, we've not been acting right, we've not been taking the right action, but this is a call to every one of us to take it seriously and then to remember that there are people out there that have never heard of it, and they don't know much about their oral health, and it's all dependent on you and I to take this message to them. Thank you very much once again for this presentation. Can anyone still hear me? Hello?
Yes, I can hear you.
Okay. Thank you very much, everyone, for joining us this morning. I can see we have um, people join us for the first time today. You're welcome, everyone. Okay, it's time for questions now. If you have a question or contribution to today's presentation, kindly drop it in the chat box. You can also signify by raising your hand emoji, and you'll be required to speak to us. For those joining us today for the first time, this is Oraposium 37.0, brought to you by Orapo. Orapo is an acronym which means Oral and Public Health. And we bring this free, it's like a clinical meeting for both oral and public health professionals to you. So you can do well to follow us in all our social media handles. Check out our products and services in our website, www.oracle.org, to be notified in any of our um, offers or promotions. Okay, I'm still waiting for your questions. So if you have any, please go ahead and drop it. Questions, commendation to our presenter and to everyone. We are here to learn, right? And also another important message for those joining us today for the first time, we have our past presentations in our YouTube channel, so you can check it up from different presenters. So you can check it up in any topic, and you will gain new insight and new knowledge. You can check our social media page, Oracle, on Facebook. We are also on Instagram. We are on Thread. Same Oracle on YouTube. So you can do well to follow us and then click on the like button, subscribe to our channel on YouTube, and we'll be glad to see you in our next presentation again. Okay, I can see a lot of charts dropping in. Okay, Chooks Amasiato, you're joining us for the first time. Thank you very much for joining. We appreciate your presence, and we look forward to seeing you in many of our presentations. He said, thank you so much. That was a wonderful presentation. Thank you. Thank you for joining us today. Thank you. Our lead mentor said, great presentation. Happy anniversary to our presenter. Yes, I'm going to come to that. Okay. Chooks is also wishing our presenter a happy anniversary, many more blessed years. Thank you. Ogechuku of Roselle Dental Smile said, well done, dear presenter, you did well. Okay, but please amplify your voice next time. Okay, sure, we've taken note of that correction. Thank you. Thank you so
Hello,
much,
ma'am.
everyone. Okay, go ahead, Ahmed.
Good morning, everyone.
Good morning.
I want to say kudos to the presenter, and most importantly, I want to say that may the good Lord continue to bless your home, and good things shall never depart your home and entire family. Once again, happy wedding anniversary. I just want to say one or two things, or to add one or two things to what the presenter has already said. It is about the fact that each time that we hear people talk about lifestyle, we only think of those lifestyles that maybe I would say maybe they are bad or that are negative. Lifestyle generally does not necessarily mean that they only affect our oral health when they are bad. It can also mean that at times we might be doing some things that are good and would actually affect our oral health. Let's take, for example, you are taking a particular medication, say antibiotics. Most antibiotics would definitely, have a kind of change in the oral normal flora. They can also predispose one to what's it called, dry mouth, xerostomia and the likes. So when that occurs, we cannot say that a particular medication that one has been taking for over a long period of time, that it's a bad thing. It's actually a good thing that would, elongate one's life, maybe as a result of a particular health challenge. But the question is, what are the negative implications of these medications? What are the negative implications of these things that we do on a regular basis? So anytime we hear about our lifestyle, it does not mean that we only look at those things that are bad that we do. We also look at some of these things that we do that are good, but have negative implications. We have seen scenarios where somebody who has been placed on medications to treat epilepsy, hypertension, and the likes would later have negative effects on the oral health of the person, maybe predisposing the person to gingival hyperplasia, xerostomia, halitosis, and the likes. So when we say lifestyle, it encompasses everything that we do generally, whether good or bad. But what we are interested in is the fact that what are the negative implications of these things that we do on a regular basis. And I think that should be our bone of contention, because most people out there, when they hear lifestyle, they only tell you, well, I don't smoke, I don't take alcohol. But yet, when you dive deep into the things that they do on a regular basis, you find out that those things are actually affecting their lifestyles, their oral health rather. For example, I actually met a patient some couple of years back when I was serving. So this patient has met a lot of dental professionals. He was suffering from teeth sensitivity. So he has taken a lot of medications, he has taken a lot of pastes, therapeutical advices and the likes, and yet he did not do well with his oral health. So when he met me, I tried everything possible to ensure that I put him through the normal things, normal routine that we do for patients like that. And unfortunately, it was not yielding. It was like they have told me all these things before. Not until I dive deep into his lifestyle. And the only problem he was having then was that he takes apple on a regular basis. I know apple contains ascorbic acid. So whenever he takes apple, he brushes within that period when he takes apple. So when he does that, what it means is that at that particular period in time, there will be some level of demineralization of the enamel of the teeth. So when he now brushes towards that period, the brushing mechanism will now erode the enamel of his teeth and predispose him to continuous dentinal hypersensitivity. So it was then I got to know that that was his problem. and he has spent a lot of money. He has visited a lot of dental clinics and the likes. Whereas the only problem he was having was his kind of lifestyle. Thank you very much. That's what I just wanted to add or contribute to what our presenter has said earlier on. Thank you very much.
Thank you very much, Ahmed, for that insightful contribution. Thank you. If you have any other contribution, please go ahead. We'll just entertain two more and we'll be done. Okay, the topic today, oral health promotion, a necessity in preventing oral diseases. So it's really something to think through. It's really something because the main aim of oral health promotion is to improve health. Aside from the main aim of promoting a particular, maybe you want to promote, just like the presenter said, you want to promote yourself, you want to promote your business. The main aim is to make sales, right? Yes. And the same way is also applicable to oral health promotion. The main aim is to improve your oral health and your client's oral health. So this topic is really, prevention. They say it's way cheaper and affordable when it compares to treatment. But many people want to be treated, like they will rather wait for them to be treated rather than preventing a particular health condition. So the awareness is low, and we as health professionals, as public health professionals, as dental health professionals, need to improve, really need to add to whatever we are doing to promote oral health. Okay, people need to hear this, our communities needs to hear and see this, that you're just talking without them seeing the effect. Some of them will come to you and they will tell you that I don't want to lose this tooth, but practicing all of these things you told me, like, it's going to be a difficult thing. Some of them are sincere, but most of them will tell you, okay, I'll do it. And they would go back and continue with their old habits and lifestyle. Okay, so what are the measures that we should take to ensure that our listeners, our audience take this promotion message very seriously, and what are the measures that we can take to help our patients or our audience inculcate these habits, these healthy habits to themselves and also to their families or to whoever that we are discussing or telling them to. I believe this question is for the presenter. How can we make like a change of behavior? How can we make our patients, our audience, see the positive side of health promotion, since it's a necessity in preventing oral disease? When you say something is a necessity, that means without this, there are many more effects when you don't do a particular thing. So let's hear from you, Cynthia.
Okay, good morning once again. The question says, if I'm correct, how should we or how can we show the people that this is right, or how effective it is? Am I correct? Okay, like there's the way we show our patients that this is effective or this is good. That's for normal one-on-one, depends on the situation or the type of people you are approaching. That's why I said there are strategies to promote oral health. I think that's the slide 12. The strategies to promote, if it's a free, like when I said is a free or there's free or subsidized treatment, for when there is free or subsidized treatment, I mentioned that people will say, I want to steal my teeth. And at the end, they will, you tell them, you need to steal your teeth. They will say, no, I don't want to. It's in my mouth, it should be there. I don't actually need it. But what happens at the end of the day when there is a free treatment procedure? You say there is a free outreach, there is this. You see all of them lined up, scattered all over the place, just to get the free treatment. So there are many strategies to promote oral health. There are other ways you can do it. You can show them pictures of before and after. when they see a picture of example and using example of pictures of before and after, when someone has using dental calculus as example, you show them this is somebody's an unskilled teeth and showing them a picture of the skilled one. That's why I said it has to be effective and attractive. So when they've seen this, they have already is self-explanatory for that. And when you're also explaining to them, it should be easy. When you are promoting the oral health, just and the way you are telling a customer that this is what you need, this is the one you need. You should buy this. This is more original. You should make it to be as simple as possible. You should tell the person in a layman's language. You don't need to use ambiguous words, so the person will not feel that what you want him or her to do in order to achieve the oral health is difficult. It should be something relatable, something that he or she can easily remember or notice. And also follow up works. When I mean follow up, you don't need to call the person off. Like when I said, there are people, most of us here in our social media every night, we scream, have you brushed your teeth tonight? Every 6 months, have you changed your brush this month? Have you every 3 months, have you changed your brush? This is the third month. Every 6 months, you shout, have you scaled your teeth? And this is a simple way, which is a gentle reminder. And most especially, using yourself and your family members as as example or sample to it, because I can't tell you that scaling your teeth is good and all this, and the person looks at my husband or my mother's teeth and or my children's teeth and they're horrible. That means that I'm not practicing what I'm preaching. So you should oral health promotion is easy. There are ways you can tell your patient. There are different strategies for different occasions. That's how it occurs. So if I'm able to answer your question, if you don't still understand, you can still ask. Moderator, please, I think if he wants to ask a question as well.
Thank you very much, Cynthia. Though I was thrown out, but I got some of the explanation you did. I'll still check it up on our YouTube channel. Okay, I have one more person that wants to ask a question. Chooks Amasiato, please go ahead with your question as we round up for today.
Hello, good morning, everyone.
Good
Also
morning.
to come in of that. Okay, my question is this: it's about a bad oral health habit of a child, precisely a 1 year old, that loves eating biscuits. So, this child has formed it as a habit, you know, all the time, biscuit, biscuit, biscuit. So, what I'm trying to ask is, how do you stop this 1 year old child that has formed the habit of eating biscuit like several times a day, not just once, like maybe 3, 4 times a day, aside eating the normal food because it's you know that eating sugary food is a predisposing factor to early childhood caries, right? So how do you stop this child from eating these biscuits without because the child once you stop giving child biscuit, the child starts crying and screaming, and do you know that this child is trying to form this as a bad habit? Then secondly, my question is, um, hello, sorry, I think I just went off. Hello.
Yeah, go ahead. We
We
can
can
hear
hear
you.
you.
Okay, sorry. So my second question is, how do you make a child? Because the speaker talked about, starting this childhood oral health, you know, oral health, teachings, at early in childhood. So how do you ensure that a baby of that age brushes the teeth twice a day, or is it supposed to be once? Because I just want to know. Thank you.
Okay, the presenter, please can you go ahead while we have few persons comments on the topic? Thank you.
Okay, the first question is how to stop a child from eating and from biscuit eating habits. Funny enough, I'm on this table. I not the child. I think I'm the child that has the biscuit eating habit. Is a bad habit that I grew up with. And what do I do? If you know you can't stop the child, there are ways to stop the child because maybe if you are given 5 sticks before, you reduce it. Like the 5 biscuits the person is supposed to eat in a day. You can reduce it like using one, you separate it in different portions. With this, the person may be eating 2.5. And mainly when the child is now eating the biscuit, what should be the major attention of the parents to make sure the child brushes his or her teeth, taking care, having a proper oral hygiene for the child because it's not when the child puts the biscuit in the mouth immediately that the caries starts. The caries starts when there is negligence, where normal how we know the factors affecting caries. When you leave the mouth unbrushed with other factors, time, we have the dental plaque and everything involved. That's when the caries occur. So you know this child eats biscuit daily and the person is now on a high risk of having dental caries. So as a parent, as I'm the one, I'm even talking to myself, I know that I'm at high risk of having caries because this is a bad habit I have. What I do is I ensure that I drink as much water as possible too, as immediately after taking the biscuit. Maybe the child can't brush the teeth at that particular point. Maybe it's in the afternoon or just finished brushing in the morning. Let the person take enough water. That's the number one. Rinse the mouth as early as possible. And night brushing should not be played or joked with. This is one of the major places the parents should consider. Brushing the child's mouth and making sure the child rinses his or her mouth after eating the biscuit and reducing the number of biscuits given. It can be, they are kids, so they cannot be smarter than you. You have to reduce the numbers. Maybe, like I said, if he eats 5 sachets, you can say it and keep in different 5 different um, places. So that's how it will occur. And thirdly, and the second question said how to make inculcate the early childhood brushing. Most kids don't like brushing. Growing up, I hated brushing my teeth. I think you just asked 2 questions concerning me. But what do I do when all my mom needs to do was to tell me it's necessary. This is what will happen when you don't brush your teeth. And now our upbringing and theirs are not the same. I think the thing is to make the teeth brushing habit fun. And when you see the person is growing, you can make the person to be independent. There are different types of brushes you can use. The finger brush is the easier one now for a 1 year old when he or she refuses to brush. The finger brush is easy. You as a parent should ensure. So when you do it morning, 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 as he knows that he's supposed to eat biscuit, when he has already known that morning and night this is the brushing ways, and the brushing is fun. That's why we say the oral health promotion should be attractive and effective. The attracting part of it then is for children so that they will not delay in adopting the lifestyle. So I hope this answers the question. Thank you so much.
Thank you, Cynthia, for that detailed explanation. I hope the presenter, the one that asked the question, is clarified. You know, a little contribution to what she had already said. Snacking is something that can't be taken away from children, especially when it comes not just biscuits, juice, all these sugary drinks. They love that a lot. So what do we do as parents? In place of these sugary drinks, we can replace it with healthy fruits, healthy fruit juice, which we can blend on our by ourselves, and we give them. And also some of these biscuits, just like you said, you can reduce it. If you're giving the child four today, for every day, from tomorrow, because you want to be intentional, be an intentional mother, and you want to help improve your child's health, oral health, you can start giving the child three. Maybe you know when, maybe he takes one in the afternoon, he takes one in the evening, and one at night. You can just make provisions and give the child three in that day, like trying to reduce it. And with time, you know, as the day goes by, when he requests, you can just open, there are just ways to it. And children loves reward a lot. Maybe you tell them, okay, because you've done this, I'm going to do this. Because you're not going to eat so much biscuit, I'm going to do this. I'm going to take you out, I'm going to do this. These are some of the things, just like their name implies, they are children, and they can easily consent to whatever we tell them. And when it comes to the habit of brushing, you can make brushing fun for them. If you don't have, another way is by inviting a professional to teach them, and to, if you can't do it alone, you can invite a professional to come over and help them, teach them on what to do. Maybe you can just book a session, a 1 month session, and like a therapy. The person comes in every morning, ensures that he or she brushes, and tell the child to do the same brushing at night. Then the next day, especially these holidays, the person comes again, trying to ask the child, did you brush your teeth last night? Tell me, how did you feel? Okay, I'm going to do this for you. I'm going to. These are ways we can help our children take actions. Okay, we can promise them the whole world, and at the end of the day, give them a little from what we promised them. It's just to make them feel the importance of doing that particular thing. And we can also show them pictures, tell them stories about how this will affect them when they grow up, just like the same way I did to, I always do to every child patient I have. I tell them stories of how this will affect their self-esteem when they grow up. These and many more will help them retrace their steps. And also, parents would are not excluded, because the main thing is in the parents, because they live together with the child. So once you're brushing, whatever you are doing, the child is looking at you. If you make the habit of brushing in the morning and in the night, once you're ready to brush at night, you can just call before the child sleeps, let's brush at night. And because the child sees you doing it, the child will also do it. Okay, so this is not something we can start today, and we expect to get the result today. No, it's a gradual process. And please don't force it on them, because they don't like anything you do with force. Okay, you just have to take them through it, promise them along the way, make it fun, dance, sing, a lot of it, and you will see them complying. I hope your many questions have been answered. We are almost running out of time, but if you have any question or anything related to the presentation of today, please do well to drop it in the chat box. The reason why we have a community chat box is to entertain your questions, your contributions. The presentation ends now, but the contributions and comments doesn't stop, it continues. So let's make the chat box lively by continuing with our questions and contribution. Thank you very much, everyone, for joining us today. I really appreciate you all. And for those that joined us today for the first time, you are really awesome. And we hope to see you in our next presentation. Okay, this is Orapu once again. This program is brought to you by Orapu, and our lead mentor is in the house. Our lead mentor, Dr. V.E. Adamo. He's been an exceptional leader and a mentor to all the fellows and the members, and to everyone. We appreciate you, sir. We love you. Thank you for giving us a voice. Thank you for giving us this platform. We appreciate you. We can't even thank you enough, because what you've done in the past year, I know I'm now a fellow of the college, and when we started, we are like the first set of people that started this, and look at where we are now. We have our third set, and many people are still applying and coming in. So you see that we are really doing a great job. So if you want to get more, to know more about us, what we do, you can simply log into our website, www.oracle.org. You can also follow us across our social media handles. Please engage in our posts. Please, we are giving all of this out for free at no cost. I know there are some oral health programs that people pay for. But at Orapo, we are giving all of this at no cost, please. But what we require from you is engage in our post, like and comment, share, invite people to join us. We want to create this awareness, just like we are doing with oral health promotion, creating the awareness, helping people to know the need to take care of their self, because at the end of the day it's still them, the benefit is for them. Now the benefit, what we require from you is to help us promote Orapo. Okay, I know we can get like 100 likes in our post today. Okay, so go after this presentation today, you can just go to our Facebook, Instagram, on YouTube. Go there, like, share, comment, and we shall see that and appreciate you. Thank you, everyone. Thank you to all the mentors in the house. We are seeing you and we love you. Thank you to all the members, Orapo College of Scholars, the current cohort. Thank you for all you are doing. We are seeing you. Thank you, everyone that joined us today. Thank you, and we really hope you have a very beautiful weekend. Bye, and see you in our next Oraposium 38. Please don't miss that. I'm your presenter, Nguchika Charity. Bye. See you.
Bye.